This is second cervical vertebra called axis. It is identified by the presence of odontoid process which is projecting upward. It is a tooth-like process projecting upward from the body. The dens is usually believed to represent the centrum or body of the atlas, which has fused with the centrum of the axis. Now body and dens. The superior surface of the body is fused with the dens and is encroached upon each side to fused with the superior articular facets. The dens articulates anteriorly with the oval facet on the posterior surface of oval facet of anterior arch of atlas vertebrae. The inferior surface has prominent anterior ridge, anterior margin, which projects downward. The anterior surface presents a prominent anterior margin which projects downward. The anterior surface presents a median ridge on each side, which there are hollowed out impressions. Now the vertebral arch. The pedicles are concealed superiorly by the superior articular processes. The inferior surface presents a deep and wide inferior vertebral notch. These are deep and wide inferior vertebral notch placed in front of the inferior articular process. The superior vertebral notch is very shallow. Superior vertebral notch is very shallow and is placed on the upper border of the lamina. These are present on the upper border of the lamina. The lamina are thick and strong. These are lamina. These are thick and strong. Now articular facets. Each superior articular facet occupies the upper surface of the body and of massive pedicle. Laterally, it overhangs the foramen transversarium. This is foramen transversarium. It is a large flat circular facet which is directed upward and laterally. It articulates with the inferior face. The superior articular facet articulates with the inferior articular facet of atlas vertebra to form ATLANTO-AXIAL joint. This is the ATLANTO-AXIAL joint. Now, the transverse processes are very small. These are very small and represent the true posterior tubercles only. The foramen transversarium is directed upward and laterally. It is directed upward and laterally. The spine is large and thick. It is very strong. It is deeply grooved inferiorly. It is deeply grooved inferiorly. It is inferior aspect. It is deeply grooved. Its tip is bifid. Its tip is bifid, terminating in two rough tubercles. These are two rough tubercles. This was the axis vertebrae.